Hey there! Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about duodenal atresia. Duodenal atresia is a congenital digestive disorder in which the first part of the small intestine, the duodenum, is completely blocked or not fully developed. This prevents food and fluids from passing from the stomach into the rest of the intestine. The exact cause of duodenal atresia is unknown, but it is believed to result from a problem that occurs during fetal development, specifically a failure of the duodenum to recanalize or form a hollow tube. Associated risk factors and related conditions include Down syndrome, trisomy 21. About 1/3 of infants with duodenal atresia also have Down syndrome. Other congenital anomalies. Approximately 50% of babies with duodenal atresia have other birth defects, which can include heart defects, kidney malformations, or problems with other parts of the digestive tract. Remember my previous video on VACTERL association? Signs of duodenal atresia can be detected both before and after birth. Before birth, antenatal. An excess of amniotic fluid known as polyhydramnios can build up in the womb because the fetus cannot swallow and absorb the fluid normally. Additionally, a prenatal ultrasound may show 2 large fluid-filled bubbles in the fetus's abdomen, representing the enlarged stomach and the first part of the duodenum. After birth, neonatal. Within the first day or 2 of life, the newborn will vomit large amounts of fluid, often a greenish color containing bile referred to as bilious vomiting. On physical examination, there is upper abdominal swelling. Additionally, the baby will pass little to no stool after the first few meconium stools. Finally, the baby will feeding difficulties where they will not be able to tolerate feedings. The diagnosis may be suspected during pregnancy based on ultrasound findings, but it is confirmed after birth. After birth, an abdominal X-ray will clearly show the characteristic double bubble sign with air trapped in the stomach and duodenum. Other specialized tests like an echocardiogram or an upper gastrointestinal GI series with contrast may be performed to evaluate for associated conditions. The definitive treatment for duodenal atresia is surgery, which is typically performed in the first few days of life after the infant is stabilized. Prior to surgery, a gastric tube is placed through the nose or mouth into the baby's stomach to suction out fluids and air, and the baby receives intravenous IV fluids for hydration and nutrition. A pediatric surgeon will perform an operation, such as a duodenostomy, to bypass the blocked section of the duodenum by connecting the healthy intestinal ends. After the surgery is completed, recovery occurs in the neonatal intensive care unit, and may take several days or weeks for the intestines to function normally and for the baby to tolerate full oral feedings. For infants with isolated duodenal atresia, the prognosis after surgical repair is excellent, with high survival rates. Outcomes for infants with other complications, particularly serious heart defects, depend on the severity of those additional conditions. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.